Now, good morning, Miss Barami.
Good morning, my lord. Our first two witnesses this morning are Mrs. Anna McPherson and Donald McPherson. Their witness statement references, respectively, for the record, are SCI WT 0494 501 and SCI WT 0412 501.
Very good, and good morning to you both, Mr. and Mrs. McPherson.
Good morning.
Right, now, you're going to be asked some questions, a few questions by Miss Barami. So when you're ready, Miss Barami.
Thank you, my lord. Good morning. You live together in Edinburgh with your two sons, I believe, and you also have two daughters who live separately. Is that correct?
That's correct. Yeah.
Thank you. Mrs. McPherson, you previously worked at the University of Edinburgh Library, but you gave that up for mental health reasons.
Yes.
Is that correct? Thank you. Now, Mrs. McPherson, I understand from your statement that you've had a difficult past. I understand that you suffered from anorexia in your teens, which subsequently led to thinning bones, increasing the possibility of fractures, and you have suffered multiple fractures as a result. You've suffered from poor physical and mental health, including some attempts at suicide. And you've had various physical illnesses, and in 2018 you were diagnosed with a neurological condition that affects your neck and requires injections every 3 months. Yeah, is that correct? As a teen suffering from anorexia, you were hospitalised at the request of your mother, and you tell us that you felt abandoned by your family. And at various points in your statement, you talk about feelings of rejection and abandonment issues. Would you like to tell us a bit more about that and how it manifests? And sorry, I should make clear, Mr. McPherson, although I'm directing the questions to Mrs. McPherson, please do feel free to contribute as you see appropriate.
If a relationship seems to be going wrong, I just have terrible feelings of abandonment, just in general. Yeah.
Okay, thank you. Now, is your full mental and physical health known to your GP?
Oh, yes.
Can you tell us about your relationship with physicians?
With the GP?
With your GP and generally with physicians, medical professionals?
I'm kind of a bit anxious about them. I worry about, I feel abandonment from them. And my relations with doctors are quite complicated. It's difficult to explain.
Unusually close, I think. Probably more likely to be wanting to please a doctor than perhaps most of the people in this room or the run of the population. It's a kind of more enmeshed relationship, particularly I think with somebody who's been involved in the mental health system. That it's not what we would call, maybe in layman's terms, a normal relationship.
And I think, Mr. McPherson, you mentioned in your statement that Mrs. McPherson is more likely to agree and go along with anything that the doctor says.
Yeah, and that was one of the more disquieting elements of the phone call, which we'll get onto later on.
Thank you. Can you tell us a bit about your pre-pandemic routine?
Routine?
Yeah.
Well, my children were becoming adults, so I didn't have so much to do for them. but I usually just did some housework and then I read quite a lot, and I'm not sure.
I think with the neck condition, you've been rather less able to leave the house as easily as before, so you have been quite kind of stuck in the house, and you have got support workers coming in several days a week, so that was obviously part of the routine as well.
Yes.
I'm at home for half of the week, the other half I'm working.
Yes. I understand you also enjoyed walks in the local community and trips to the local pub, is that correct? But
Yes.
prior to the pandemic? Yeah. Thank you. And you also attended an action, the action group, which was a support group provided to you through social work, and you received care at home 3 times a week prior to the pandemic.
Yeah.
But that didn't continue once the pandemic started, and instead they would telephone you on the days that were scheduled to visit. And Mr. McPherson, I understand you took time off from your work for a period of 5 months.
I had 5 months off between March and August 2020 before I returned to work in the office. Yes. The working from home option, I think, because of Anna's condition, would have been a very difficult one for me to take. Yes. So when I went back to work, I went back to the office where I work, and that's a situation that's still pertaining at the moment.
And during that period where the care at home wasn't provided, you essentially became your wife's main carer. Is that correct?
That's right.
Yeah.
Yes.
Thank you. And once the pandemic started, despite having issues with your lungs, you were never put on a shielding list.
No.
Is that right? No. How did you feel about that?
Abandoned. And quite upset, a bit angry.
Yes. You had been seeing a psychiatrist once every 3 months, and that continued, but at the rate of once every 5 months, and then after 2 years returned to 3 months again. Is that correct?
No, it's now gone back to 5 months again.
Oh, right.
Yeah.
Okay. And through the pandemic, you continued to have regular telephone calls with your GP?
Yes.
Is that correct? And you tell us that on the 3rd of April 2020, you were at home with your daughter who was visiting you when your GP called you out of the blue. Usually you would have called your GP when you saw a need. And you state that you weren't ill at that point, nothing had changed for you, and your GP didn't ask if anybody was with you in your home. Could you tell us about that phone call and what your doctor said to you and how you responded, please?
Well, I was surprised to get a call from her, and she just said, I'm ringing to ask if you'll agree to have a DNR on your file. And I was kind of taken aback. And I said, I don't think my family would like that. And she said, but what about what you want? As if I would want to die, in that way. Basically that your life's not worth living, So it was very distressing,
Now, a DNA CPR decision should only relate to the administration of cardiopulmonary resuscitation and shouldn't affect the provision of other forms of resuscitation or treatment. Did the doctor explain to you what a DNA CPR decision is and how it would take effect?
No.
Did the doctor explain the basis on which she might have considered a DNA CPR decision to be clinically appropriate for you?
She didn't say so, no. I just said, no, I don't want that. I was kind of shocked, and I just couldn't believe what she was saying, you know.
Yeah. How did you feel about receiving that call? I think you talk about it in paragraphs 54 and 56 of your statement. Would you like to tell us?
What was that, sorry?
Would you like to tell us how you felt on receiving that call and the thoughts that you had?
Oh, I just felt suicidal, and, you know, probably if my daughter hadn't been there, I might have done something to myself, you know. It was just dreadful.
Yes. And you state that in paragraph 58 that some months later you called the surgery to ask if a DNA CPR decision was noted on your records, and you state that your GP apologised for having asked you that question and explained that it had been a management instruction. Could you tell us about that conversation and whether you were told who issued that management instruction?
No, they didn't tell me, no. That's what I want to know as well, is who got her to do it. But obviously she agreed to do it, you know. And I mean, she knows my medical history. She's the GP I've always gone to. And it's, you know, if you have mental illness, you often have feelings of suicide. And for her to almost say, oh, this is a way for you to opt out of life, you know, if you agree to this.
Is that how it came across to you?
Yes.
Yeah.
My life wasn't worth living, you know.
Yes. And you've told us that the immediate effect was to make you feel suicidal, and if your daughter hadn't been there, then you might have done something. Has it had a longer term impact on you as well?
Yes, it has, yes. I just feel traumatised still. And it's affected my health care. You know, I don't trust doctors even less, you know. With her, I'm always worried about in case I've upset her or something, you know. And other people say I shouldn't be worried about that.
Mr. McPherson, could you please give us your thoughts on that telephone call and tell us how it's affected your family?
I mean, I wasn't physically present in the house, but when I came back to the house, I could see that something had happened, and Anna was genuinely shaken, and so obviously asked what had gone on, and was really pretty appalled at the train of events, really. As Anna has said, this is a doctor who is fully conversant with her mental and physical frailties, also the extensive medication that she's prescribed for various things. There's also, I would say, a question of whether Anna could have been judged to be mentally competent to make that sort of crucial decision on her own. The business about what seemed to be, from what Anna said, cutting her family out of the discussion struck me as very wrong as an approach. This is not what a GP should be doing. But you know, it does seem as if this came from above, and really the overwhelming thing I have about this whole affair is who really set this in motion, who fired the starting pistol on this, because I know that this has happened to other people as well. in Edinburgh, for certain. That's what I do know. 3 other practices for sure where this has happened, and I just felt that the effects that it's had on us. I'm certainly very distrustful of that individual doctor now. You know. So I think it was all round a very bad thing. Somebody as mentally and physically frail as Anna is, but was well. I would stress at the time, she was, by her standards, relatively well, and there was no real justification of wading in and trying to get this put onto her file. There was no mention of COVID, but it's hardly coincidental, surely, that this phone call was made in April 2020. You can read into that what you will, but it's pretty obvious that something was going on. It's hard to really countenance the idea that several GP practices spontaneously decided to phone up people and ask them if they wanted these DNRs put onto their file. I just don't believe that was the case, particularly given the time it happened, as I say.
Yes.
So.
Thank you. And subsequently, in September 2021, Mrs. McPherson, you contracted COVID and were admitted to hospital. Please, could you tell us about your symptoms and what happened on admission?
Well, I met this friend for coffee, and she divulged to me that she'd been in the presence of people with COVID, and my heart sank, because I thought, oh my goodness, this woman might have it. And anyway, 2 days later, I started feeling really unwell physically, like shivering and sick, very sore throat, really bad. And I just seemed to get worse very quickly.
Right, Miss Barami and Mr. and Mrs. McPherson, I understand the problem's solved, so we can go on. Thank you.
Thank you, my lord. Mrs. McPherson, did your family then take you to hospital?
Yes, yes.
Would you like to tell us how things progressed thereafter?
They took me, it was like very late at night, and they took me to this receiving unit, and I didn't know what was going on. I couldn't understand things. Apparently I was talking rubbish, and you know, my daughter was very worried. They did some tests, and then they transferred me to another ward. And then after that, I became unconscious. So I didn't really know about things for a few days. And then I woke up, and I didn't understand where I was. And they said, oh, you're in the COVID ward. And I couldn't believe it, that I'd got it, you know. So I was in there 2 to 3 weeks. Had antibiotics and steroids and various things done, so it was quite frightening. And I thought to myself, you know, if I'd let the doctor put on the DNR, they might not have treated me. They might have just left me to die, which was very distressing as well.
The DNA CPR decisions shouldn't affect that level of care that you receive, but your answer is indicative of the fact that that wasn't explained to you, it seems. Was the issue of DNA CPR brought up again in hospital?
No.
Were your family ever allowed to visit you in hospital?
No.
I visited once.
Yeah.
I think my daughters visited, but couldn't go in. I went in once, but you were completely unconscious. In fact, I had some worry that you were actually dead. And I just sat in this room because you were so lifeless, you know. That was my only visit. Luckily, a nurse came in, and it turned out that was obviously not the case, but it was that sort of situation. I was not confident that that you were going to survive, put it that way.
Would you have liked to visit more often? Were you prevented by the guidance?
Yeah, I was prevented by the guidance. I was just allowed that one visit. So yeah, that was the way it was.
Were you able to have telephone calls with each other?
Not initially, because you were unconscious, obviously, but later on, yes. But I mean, I did have a few phone calls with staff. The one in which sticks in my mind was one where I spoke to a doctor, I think, and was basically told that the next 24 hours were going to be crucial, from which I took as to whether Anna would survive or not. So that was, I think, the worst of the time that she was in the hospital. It was very, very worrying, and I had mentally resigned myself in a way to losing her at that point.
And thankfully, you did recover and you were discharged. Would you like to tell us how things have been since you were discharged?
Well, physically.
Physically and mentally.
Well, you know, things are always a bit up and down, and I mean, like most people, the pandemic was ghastly, you know. And I was worried about getting it again, things like that. And mentally, I've been struggling with things, not least this phone call, because I don't think somebody of my age is like, you know, beyond the pale or something. You know, I know much older people he didn't get a phone call like that. So I'm not sure why I was picked for this call, but I'm mostly thinking it was because of my mental health, because they think that your life isn't worth living, which is kind of shocking and distressing.
Thank you. Thank you both for coming to give evidence to us today. And we have both your statements and we'll consider them alongside your oral evidence. I hope that you felt heard today, but is there anything we haven't covered that you would like to mention at this point?
I suppose I would reiterate that what I want from this is to find out who put this set of events in train, how they did it, why certain people were singled out to be phoned. I mean, I'm 2 years older than my wife. I was not phoned. My mother was 91 at the time that this phone call was made. She was not phoned. So what were the criteria?
Yes.
Were they laid down from above? Were GPs told to draw up their own list? How extensive were those lists? Did some GPs refuse to do this? Were there repercussions for their careers if they didn't do it? There's all sorts of things attendant on this course of action, which I think at its most charitable is really unfortunate. This is not the finest hour in general practice.
Yes, thank you. And on that point, we heard from a witness who wasn't a GP, but somebody who had experienced other people being contacted about this and had an impression that it may have stemmed from GPs preparing shielding lists. But in your experience, that can't be the case because Mrs. McPherson was never on a shielding list.
We had to make the decision to essentially confine her to the house.
Yes.
Ourselves.
Yes.
If she was that vulnerable, she was vulnerable enough to get an unpleasant phone call like this, but not vulnerable enough to get a shielding letter.
Yes. Thank you. Mrs. McPherson, is there anything you'd like to add?
To ask.
To add to your oral evidence before we conclude.
I mean, I just wondered if it was in some way my fault, you know, that it's any of this, you know.
Although it's not part of the evidence, I'd like to reassure you that it doesn't seem to be in any way your fault. It seems to have been, as Mr. McPherson said, something that was being carried out at that time.
Yeah.
Well, very good. I'd like to thank you both. Could I also reassure you, Mrs. McPherson, nothing you've said indicates any blame on your part. Please don't feel guilty or you're at fault for anything. But thank you both very much for your evidence. I'm very grateful. Thank you.
Thank you.
Thank you.
Yeah, good. Right, that's all. Ms. Barami, I know you've got the next witness. I'm not quite sure about timing arrangements, but just make the arrangements that are suitable for yourself and the witness, and through my personal assistant, she can send me a text when you're ready to start.
Thank you very much, my lord. I will do.
Very good.
Thank you.
Thanks. Now, good morning, Miss Barami.
Morning, my lord. Our next witness is Kate Stott, and her witness statement reference for the record is SCI WT 0397-501.
Good morning, Miss Stott.
Good morning.
Right, Miss Barami's got some questions for you, and we'll just start when she's ready. Thank you.
Thank you, my lord. Good morning, Miss Stott.
Morning.
So starting with your background briefly, you had a few health issues as a child which resolved by adulthood. And as an adult, you began experiencing Crohn's disease, and alongside that, you have annual bouts of strep throat, alongside reactive arthritis and weakness in your legs. Is that correct?
Correct, yes.
Thank you. Now, in March 2020, you had a throat infection for which you were prescribed antibiotics. You experienced extreme fatigue, backache, loss of taste and smell for 48 hours, and you had a temperature of 39 degrees for 3 days. And your symptoms continued into April, and you developed further symptoms. Would you like to tell us about the further symptoms that you developed?
Yeah, of course. I mean, I'd like to possibly expand on what that infection stood apart from previous infections, and that was just this overwhelming sense of I can't move. And the thing that was initially different was the pain and the burning sensation in my legs that came on quite quickly with that infection. And as the weeks progressed and I'd finished the 2 courses of antibiotics, I would have shortness of breath that I've never ever felt before. I was quite young, I had children, I was very active. So that kind of took me by surprise in terms of I had to stop activities that I was doing in order to catch my breath, which was really, really unusual at the time. And, things just got progressively worse with the symptoms as time went on. It wasn't linear by any means. I'd have good days and then I'd have bad days again where I'd be back stuck in my bed at 4 o'clock, which was just completely unusual for me. I was very used to being active and busy and hands-on. So the alarm bells were ringing at the time. Something is different here. Something is wrong.
Yeah. And you believe that you'd contracted COVID, although at that point there weren't any tests to confirm that?
Yes, and that's what I believe. And with subsequent infections that I have had after that, I've always had, not always, sorry, but for the most infections, I've always had co-current bacterial infections as well at the same time as catching COVID. So looking back now, it makes sense that I'd had possibly the same thing.
Yes. Thank you. And throughout 2020 and 2021, your symptoms continued and you were lethargic and your Crohn's flared up on a weekly basis. Is that correct?
Yeah, so the easiest way to explain it is it felt like someone had thrown a nuclear bomb at the Crohn's symptoms per se. I was getting constant internal intestinal inflammation. I had inflammation in my eyes, something called episcleritis. My joints were really sore. I had bouts of my legs just completely giving way. So I'd be walking and they'd just go. And it just felt like I wasn't catching a break from any symptom whatsoever. And that's when my gastroenterologist team decided to start me on some treatments then as well.
And by July 2021, your symptoms became so severe that you were admitted to Aberdeen Royal Infirmary.
Correct.
And you were given antivirals and antibiotics. Would you like to tell us about the symptoms which led to the admission and how you found the process of being admitted and your time in hospital?
Yeah, absolutely. It's important to backtrack a bit to April of 2021. My gastro team at the time had decided to start me on a medication called a biologic, and it was called adalimumab, and it's not unusual for people with IBD, Crohn's disease and colitis to be started on these types of medications. They're immunosuppressants, and I started B12 injections at the same time. So initially, after a couple of weeks, I started noticing a huge difference, and I felt great. I'm back to normal again. And a couple of weeks prior to that, sorry, about 3 weeks prior to that, I'd had my first AstraZeneca, where I'd had an allergic reaction to the first jab, and had a rash, and I felt really unwell. I'd had cold, kind of shivers, shakes, and it felt like another COVID infection. So it took me about 3 weeks to get over that. So then when I'd started the biologics, just after that, it was just such a huge relief to feel a sense of betterness again. And so I continued back at work, and I was just so happy and relieved to be feeling well. I took a bad bout of hay fever, and again needed some steroids. I'd lost vision in one eye whilst driving at one point, which was a bit tricky and scary at the time, but it resolved. And then I got my second AstraZeneca and felt completely unwell again during this time where I thought I was just getting better. I mean, this is after a year of constant symptoms. And 2 weeks after the second one, I got admitted with the worst headache I've ever had in my life, and I still haven't experienced something like that since. Immediately couldn't stand any light. My neck went stiff. I was vomiting. The pain in my head is indescribable, completely indescribable. So the staff at ERI were amazing and admitted me straight away. They gave me a lumbar puncture, a CT scan of my brain, and they attributed my symptoms to being viral at the time. Within a few days, I developed vertigo, really bad vertigo, where I just felt like everything was spinning constantly, and they attributed that to some kind of labyrinthitis type inflammation. So I got home after about a week from ERI, held off from taking my biologics for a little bit till symptoms kind of felt a little bit better, to chance going back on the medication again. But as soon as I went back on the biologics, the vertigo eased up, but I developed a limp in my leg. And not long after that, I developed ptosis in my eye, where my eyelid would droop. And things just got progressively worse from there. And I struggled to articulate just how life altered after that, during that time period. And the worst time period for me was between August 2021 and March 2022. I lost my memories completely. I lost the memory of marrying my husband. People would ask me things, and I just couldn't. I'd become housebound. I became bedbound. I couldn't move. The pain was insidious in terms of my spine and a crushing feeling around my ribs, and it was relentless.
Thank you. And did they test you for COVID when you were admitted to Aberdeen Royal Infirmary?
I believe they did.
Yeah. But it was negative at that point?
It was negative. I believe it was negative at the time, yes.
And you've mentioned that you'd just had, and I believe it was 2 weeks before your admission to hospital, you'd had your second dose of the AstraZeneca vaccine.
Yeah.
And you mentioned that you'd had an allergic reaction to the first, but you were advised by your GP and the administering nurse to proceed with that. And moving forward in time, you didn't have a reaction to your third vaccine in October 2021, which was the Pfizer vaccine, and no reaction to your first Moderna booster jab in January 2022. But 11 days after your second Moderna booster jab in May 2022, you state that you were admitted to hospital again, and you state that a direct correlation with the booster was noted on your records.
It was,
Is that
yeah,
correct?
yes. And that was with breathing difficulties. I'd had bouts of chest pain that was intense, And I really must try and stress that at that time, it was incredibly difficult to get healthcare, to get a GP, to get anything. So when things were bad for me, they were really, really bad enough to seek medical help. You know, it wasn't an option for me to just nip up to the doctors or anything like that. So these times were, okay, this is urgent. I need to get up to hospital.
Yes.
Yeah.
Thank you. And going back to 2021, in paragraph 27, you state that your neurological and extreme symptoms started in that summer. Are those some of the things you've spoken about? The memory loss?
So the memory loss being the most concerning one. I don't know about anybody else, but I think in terms of being a human being, you can live with extreme amounts of pain, and you can muddle through with illness. But the most concerning thing for me was losing my memory at that point.
Yes.
Because nobody could tell me what the future lay ahead. Yeah.
Thank you. And on the 20th of December, you were again admitted to Aberdeen Royal Infirmary.
Correct.
Could you tell us what led to that admission and what happened during your time in hospital?
Yeah, so about 24 hours beforehand, I'd had a hairdresser come to the house to cut my hair, and I was feeling so unwell at the time. I said, can you do something just to make it look a bit better? I'd been housebound. She said, yeah, let's put some bleach on. And it's something that I was blonde at the time. I'd never had a problem with bleach hair dye before. And when she popped it on, I immediately went bright red, and came out in a rash. And I had no breathing difficulties or anything, so I didn't see the problem of, I didn't need a doctor. So I took some Benylin, and, everything calmed down that night. Sorry, that was 40 hours before the hospital. The second night after that, in the evening, another extreme bout of vertigo came on, and I found myself having to literally crawl up the stairs to get to bed. I was sick, but I managed to sleep that night. The following day, I woke up with breathing difficulties, shortness of breath, chest pain, and ptosis in my eye again. I mean, these are symptoms that I'd never had before, previously. My husband took a look at me. He said, we need to get you up to A&E. And that's where we went. Yeah.
And what happened once you were admitted to hospital?
So we had to wait about a bit in that winter. I remember it being particularly busy. They admitted me at ERI. I'm not quite sure they knew what to do with me, to be honest. I had some low blood pressure, if I remember correctly. They gave me some aspirin. Initial kind of concerns were there was maybe something happening with my heart. Looking back, I've got copies of my notes now, things like my venous oxygen was low. I got up to try and go to the toilet. I collapsed without losing consciousness. My legs just weren't working well. My ptosis was quite bad. But more so, I was so out of breath. I couldn't speak a full sentence. And I didn't feel like I was being taken seriously. I had a doctor say, what do you want me to do about it? And at that point, I knew I need to just get home. So yeah, that visit is ingrained in my mind in terms of just not being very helpful enough.
Thank you. Then it was in March 2022 that you had your first positive PCR test.
Correct.
And in the same month, you were diagnosed with long COVID and with ME, stroke CFS, chronic fatigue syndrome, by a neurologist at Ross Hall in Glasgow. And in paragraph 42, you've mentioned already the memory loss, but there you talk again about needing a brain MRI.
Correct.
Was that also in March 2022 that you had that done?
Yes.
And prior to 2022, you had been working full-time on your business.
I had.
and you had won Scottish Business Woman of the Year that year.
I'd
or
won that in
previously, sorry,
2019.
2019, yes.
Yeah, before I fell out. Yeah.
Yeah, thank you. But by 2022, your symptoms unfortunately reached a point where they prevented you from continuing work.
Yeah.
Is that right? And in your view, that was due to the long COVID and not the Crohn's disease?
Oh,
Yeah.
without a doubt. I mean, if I can expand, I tried to set myself daily tasks, and it is so hard to articulate how much this disease takes over your body in terms of your energy and your capability. And I tried my best to give myself tasks every day to get through the day, to accomplish something. And my weekly task was ordering the food shop for the family. And my daily task was folding up one load of washing. Now, for me, I'm a plate juggler. I love being busy. So that was unheard of to get down to that level of management throughout a day. And if I tell you, I found it impossible to complete that weekly food shop online. Not only because using the phone was difficult at times, it would take so much energy to read. But I would get to the fridge, I would literally hobble and pull myself to the fridge to look in the fridge to see what we needed, and I couldn't remember the names of anything. So things like butter, things like bread, milk was impossible, absolutely impossible. So that weekly task, just getting through that alone, was ridiculously tough. And folding up the washing for my children would then require a 4-hour nap afterwards. I mean, it seems ridiculous, but that is the reality of how bad I and others are suffering.
Yes.
Yeah.
And you mentioned that there are medications to help with
Correct.
Crohn's.
Yes.
So those would address any symptoms of that.
Of
Yeah.
course.
Would you like to tell us a bit about your business and your business activities prior to these things starting?
Yeah, I'd like to possibly just address what we touched on there in terms of Crohn's disease. Up until 2020, I'd been self-managing my Crohn's. You know, I'd been under investigation since I'd had my last child, and things had been flaring up and continuing to flare up. But I was managing it through diet. I'd cut out very, very little alcohol and taking supplements as and when I could. And managing it okay. You know, it wasn't great, but it was ideal in terms of not having to take medication. But I was still a very active, busy person, and a very, very capable, active, busy person. That disease of Crohn's never, ever affected me like long COVID did. And they are two beasts of illnesses. They're very, very, very separate. And the difference with Crohn's disease is that we have care pathways in place. We have treatments available, and we have doctors to tell you that we've got options. You know, things will get better. We can try this, we can try that, and we will support you through it. And that's so important for a family who is supporting someone who's sick to hear that, let alone for the individual. With long COVID, there is none of that. And we have far more extreme symptoms on the long COVID end of the disease. And there's no options right now. So I just wanted to explain the difference there.
Yes.
In terms of my business, we were doing really well, really, really well. I was incredibly proud to have started something from scratch. And through the lockdowns, you know, like everybody else, every business shut down, and I decided I wanted to pull up my sleeves and help people. So I decided to try and reach out to government at the time, and I set up a support group. I think at the highest peak we had 1,800 hair and beauty businesses from throughout Scotland, and I directly reached out to Kate Forbes' team in order to try and get some guidance on how I support those folks, and yeah, we kind of liaised back and forth in terms of how do we help them with grants and grant applications and safety protocols for opening up their business again. And that was through 2020. Now, I was ill and I was getting progressively worse that year, but I was able to do my job. But after 2021, you know, after those specific symptoms kicked in, I wasn't able to even write an email. And at that point, when we'd relaunched after lockdowns and whatnot, I couldn't even sell the business. I was in no fit state to go through an acquisition. I couldn't write an email. I couldn't dictate anything. I couldn't remember spelling. And therefore, I had to shut my business down.
Thank you. Then in May 2022, you were again admitted to Aberdeen Royal Infirmary, this time with shortness of breath and low oxygen saturation. A chest x-ray returned normal results, and so you were referred to cardiology. Then in June 2022, you contracted COVID for a third time, and you've touched on it already about the lack of services, but in paragraph 52, you state that as there were no long COVID services in Scotland, you travelled to Mulheim in Germany to attend a long COVID clinic. When was that?
I travelled to Mulheim initially in the August of 2022, okay. So it had taken a long time from applying for the appointment in Germany to actually getting the appointment. So as soon as we got a slot, we booked and we went at me and my husband, who's incredible, wheeled me out there in a wheelchair. And when we got to Germany, for him to have someone educate him around long COVID was incredible. To have that support for myself, but for him to sit him down and say, right, this is what's happening, this is what's showing in Kate's blood, this is the problems, and this is how we're going to try and treat it. Yes. And I burst into tears at that point because that support wasn't available here. Not only was it not available here, it had been so largely dismissed up until that point. I think we're getting to a better point in Scotland now, but during those years, it'd been impossible to try and get any answers.
Yes, and the clinic ascertained that you had microclots, hyperactive platelets, and endothelial damage.
Correct.
And they thought that that was a consequence of strep throat and COVID-19.
So not directly strep throat.
Okay.
I had high heart inflammation markers as well. So they didn't know if the reoccurring bouts of strep throughout my teenage years and adult years had maybe weakened my heart muscle. So then when I got hit with COVID, it was just the weak part of me. But yes, my heart inflammatory markers were really high. My microclots were visible in my blood, and my platelets were hyperactive. But I guess most concerning was the endothelial damage within my vascular system at the time. Yeah.
Yes, and in September you started treatment for those symptoms.
I did.
And then in November you returned to the long COVID clinic in Mulheim to start an experimental treatment that was usually given to people with sickle cell disease.
Correct. So it was a slightly altered treatment from that's provided for those with sickle cell disease. Okay. This time, heparin was added. So it was called apheresis. The machine is basically 2 IVs in each arm, and your blood is filtered and mixed with heparin and popped back into you. My mum took me out at that point. The treatment took 3 weeks. I'd never been away from my children for that long. I'd never been away from my husband that long, so it was incredibly difficult. But also for my mum, she had to take care of me for 3 weeks and wheel me about Germany, which is incredible. So yeah, that treatment, I felt awful going out there. The journey itself took a huge toll on me. I'd been on the triple therapy, which is, I don't know if I'm allowed to say medications, am I? Yeah.
Yes.
So the triple therapy consisted of antiplatelet medication, aspirin, and another blood thinner. But when I got back out to Germany for the second time, they reran the tests, and my blood was still clotting fast and thick. So it was decided then that after my apheresis treatment, I would switch out one of the blood thinners to heparin, daily heparin injections as well, coming home. I saw quite a noticeable difference coming home after the 3-week treatment. I had a wee bit more energy, I had a wee bit more strength, but I can't tell you at the time how much I would have just given any of you here a limb just to feel better. So any improvement was a bonus for me. And that winter I was able to cook Christmas dinner for the kids. So it was worth it. I got a chest infection just after Christmas that year, and it put me right back to square one. Completely back to square one. And then I got COVID again.
Yes.
And I got sick again. And it was just relentless. It was any kind of break that you could try and catch would then hit you again with another infection. And I guess that's why I'm here today, because I'm lucky to be sitting here today. There is hundreds of thousands, if not millions within the UK that are getting these breaks, that are getting these glimmers of windows of feeling better, to then be hit with another infection that debilitates them again. And it doesn't just take a couple of days to get over or a couple of weeks. It's months, and if not years. And we are looking at years for a huge majority of people now.
Yes. And you tell us in your statement that when you started, in paragraph 57, you say that when you started to feel better around December 2022, as a result of the new medication, you relayed that information to your GP, and your GP made a referral to Aberdeen Royal Infirmary, but they were unable to accept the referral because of the lack of treatment there.
Their choice of words were they had no experience in treating. Please don't quote me, and I do have the letter. They had no experience in treating, so their recommendation was that I stay private.
Okay. Yes. And then, as you've touched on, in the next paragraph, you go on to say that between December 2022 and February 2023, you had continuous infections. What kind of infections were those?
So I mentioned the chest infection, UTIs, kidneys, just continuous. Yeah.
Then the following month, you were again admitted to Aberdeen Royal Infirmary, and in April 2023, you were given methotrexate by the rheumatology team at Aberdeen Royal Infirmary, and then within a month or so, it became easier for you to move. Did that have a significant impact?
Huge. I can't tell you. Sorry.
Oh, sorry, I was just going to say, and in January, you resumed driving again.
Yeah. So bearing in mind, it'd been 3 years. 3 years in total that I hadn't driven, that I wasn't able to take the children to school, that basically wasn't able to walk from the front door to the car, let alone get in the car and take them to drive. So if I can just pull back a little bit and go back to April, I'd had enough at that point. You know, I'd been to Germany. I thought this is my chance to get better. And then I got infected again, and I thought, I've got no options now. You know, where can I turn to? Rheumatology had discharged me back in, I want to say 2021, with enteropathic arthritis, and they said they couldn't do anything more for me. But I got a bit of Dutch courage in terms of just a bit of bravery, and thought, I'm just going to directly email them myself and tell them what's going on. I'm not going to go through the GP because it takes forever to get an appointment, and then relay all this information back again, and then wait for a referral letter, and then wait for an appointment. So I directly emailed them and I said, listen, I'm having a lot of pain. I'm in pain. It's affecting everything, life, sleep. Can I get an appointment? And they came back and said, absolutely. So I went in and I relayed everything in terms of the long COVID and the Crohn's. The Crohn's had been okay until that point. It'd been behaving on the biologics. So she said, let's try you on another immunosuppressant. Let's try you on methotrexate with the biologic. I said, super, okay, because when I've had steroids, everything has kind of quickly changed. And within a month of starting that additional methotrexate, I was walking down the beach with the dogs, with my husband. And everybody deserves that. Everybody suffering deserves their life back again. And yeah, it was really, really incredible. And since then, we've upped my dosage another 2 times, and I've seen improvements every time. It took a while to get back to driving. It took a while to get back to work, and I took it really slowly. But yeah, it's been good.
Thank you. And in paragraph 74, you state that you were never advised to shield. Is that correct?
Yeah. At the time when lockdowns were announced, I wasn't officially diagnosed with Crohn's. I wasn't on anything that would put me at risk in terms of medication. So yeah, I wouldn't have been on the register. I was seeing a gastroenterologist under suspicion of having Crohn's, but yeah, nothing would have flagged up in a system that would have alerted anybody that I was at risk.
Thank you. And in paragraph 75 to 78, you talk about a range of vision problems that you experienced.
Yeah.
Were those related to COVID or to long COVID?
I believe COVID, because I've had difficulties when looking at a screen and things like that. I think what everybody does when you reach your mid-30s, things change. But my vision changes were quite sudden within 2021. So I'd be looking at the TV, my eye would droop. I would get double vision. There would be things happening in my peripheral vision, shadows and whatnot. The biggest kind of change was changing light. So coming into a dark space from a light space, my vision would change quite drastically.
Okay, thank you. And in paragraphs 85 to 88, you speak about the effects of fatigue and say that that was the most debilitating symptom. You've touched on it briefly, but would you like to tell us some more about that symptom?
Yeah, I think
and the effects.
For the general public, you can only hear words and attribute it to a feeling. But fatigue doesn't do long COVID justice. You can't empathise with the word fatigue. For me, fatigue was a constant, sedated, concussion-like feeling. It was like you were on general anaesthetic and being stuck counting down from 10 and you were stuck at 3. And that's how you operated every day. And some days were a little bit better, and some moments of the days were more manageable, but some were worse. But for the majority, you were stuck at that 3. And I was lucky if I was able to have a shower in the morning and still be okay to cook dinner for the kids at night, because that's how bad it was. If I wanted to be able to cook dinner for the children at night, I had to forgo the shower in the morning, because it just took so much out of me.
Yes, thank you. Could you also tell us about the impact of long COVID on your mental health, your word recall, and your ability to focus?
Yeah, of course. I don't speak for everybody here when it comes to mental health. I know there is people out there that are very, very much struggling. And quite rightly so, after 4 years of being ill with very little support, it would have a huge, huge toll on your mental health, and especially if you have no support at home. I feel incredibly lucky because I had all the support I needed at home in order to make sure my children were okay, that they got to school okay, that they were happy and healthy. And as I said, I have an incredible husband who made sure that I was okay every day. And in turn, my mental health didn't suffer. And I felt so strong and so determined to get through this illness and get to the bottom of what was happening. But I am sure if I had to go on like that for another year or two, or didn't have my husband, who was incredible, my mental health would have suffered immensely, immensely. So in the short of it, my mental health was good. It was really good. I was determined. The other effects, like the memory loss, really hard to deal with, but just confusing. If somebody had sat me down and said, we know this is what's happening, it might take 3-4 months, we're sure of it, or 6, but you're going to be okay. I think the worst part was that nobody was able to sit there and educate and say you're going to be okay. You'll get your memories back. So yeah, in terms of neuro symptoms, yeah.
Thank you. And finally, please would you tell us about the impact on your family life as well?
Yeah, this one's tough. This one is tough. I have 3 children. My oldest is 16. My youngest daughter is 8, and my son, my youngest, is 7. Now, when I fell ill, they were babies. My teenager, who is now 16, was a baby too. And for the most part of it, my son had no memories of me being well. And he had no memories of me being able to be at the park with him, take him to school. And that was tough. That was tough because I didn't know when I was going to get that back again. My husband had to hold down a full-time job, working from home, looking after 3 children, and not having any medical support in his hometown to tell him that his wife was going to be okay. There was no treatment at hand. And we're not speaking about days or weeks or months. We are speaking years. And that is time I won't get back again. That's time he won't get back again. But most importantly, that's time my children won't get back again. And they are not the only children who had to go through that or is going through that. The effect on my family, and bless them, they got on with it. But it was life-altering and huge.
Thank you. Now, we have your written statement, of course, and we'll consider that in its entirety alongside the oral evidence you've provided today. Is there anything of significance to you that we haven't covered today that you would like to address at this point?
I've got something to say, if that's okay. I've prepared.
Thank you.
Ahead of today, I reached out to those suffering and asked them to summarise long COVID in one sentence. Here are some of their replies. Sam says, an existence rather than a life, a state of near invisibility. Rob says, COVID-19 has disabled more people than it has killed. To this day, almost nothing has been achieved in Scotland for those affected by this silent pandemic. Diana says, long COVID has robbed us of our identities and the fulfilling lives we used to live. We wish we could continue to work, but that seems impossible at any point in the future if treatments aren't found anytime soon. Amanda says, life-destroying, spending every day with symptoms that normally 111 would send you to A&E for, but with no help. Sally says, it's painful, Really painful. I'm so sick of people just talking about the fatigue and making it seem so benign. They are missing the worst parts of this illness. What level of disability across the community are we willing to tolerate? I could go on, but long COVID requires a response, from governments and budgets to policymakers and public health messaging, and finally to Scottish private research and treatment investors. My question is, what is the plan, and who will be the adults in the room that will take charge to enforce change? For too long, we have become apathetic to large numbers of suffering. There were times we as a society would have been horrified to hear of over 2 million people enduring a disease like the one I've tried to explain today. Our society cannot afford to turn a blind eye to the plight of over 2 million individuals grappling with a disease that lacks effective treatments. It is a matter of basic humanity. Even if we don't know the whole picture of what the virus and vaccine injuries are doing to our bodies, we must start treating the symptoms of those suffering. These are standards that the general public have the right to expect from one's government and healthcare service. But too often than not, people are being dismissed and the sickest are stuck on waiting lists to see specialists that are sending them on to additional departments to face months, years of another waiting list, all whilst their health declines. Time is lost with their families and children and their careers, time that you cannot get back. I'll be honest, if I didn't have to speak of long COVID again, it would be a relief. But I am incredibly thankful for the inquiry for inviting me here today. I know far too many people, men and women, and not to forget children, who are still suffering with no relief, with no schooling, lost jobs, with no social lives. Some people have children. Some had hopes of having children. They are bedbound, housebound, and left using wheelchairs with no end in sight. The science keeps telling us one thing, and our government and our public health policies keep telling us another. The elephant in the room must be addressed. People are still being infected and continue to develop long COVID. Your risk of long COVID rises with each additional infection. This must change, but who is leading? Thank you.
Thank you very much.
Yes, thank you, Ms. Stott.
Thank you.
Right, that's the evidence for this morning, 1:30 this afternoon.
Thank you, my lord.